Good morning and welcome to Farm Space. Okay, yesterday Dr. Annie Hentzen told us about preconditioning in the feedlot, and today he will be talking to us about how to keep your cattle healthy in the feedlot. So make sure you watch the rest of the program, and we will continue tomorrow with our last episode. So until next time, cheers.
Today we're talking about the health. The health is of critical importance once again in the feedlot. You can buy the best calf, the best genetics, but if it's not healthy, it will not be able to express it. So that's why we stand still today, just to focus a little bit on it. The last video we spoke about preconditioning, which lays the foundation of the health. The next one is if the cattle come in, or the calves come in into the feedlot. So there it starts with processing. And at processing, we give certain vaccinations to improve or protect those cattle's health. The bovine respiratory disease complex is one of the important ones, and usually you have used a vaccine already at preconditioning and you boost him as he comes in. I'm just going to give some other guidelines, which is not specific to each and every feedlot, but needs to be sorted out with the consulting veterinarian. But guidelines are, as I said, BRD vaccinations, clostridial, we need to vaccinate against anthrax, which is compulsory in this country. Then I want to stand still with a few things that we need to look at and which are important and influence your production of these calves and the health as they go into the feedlot. Parasites. Some of the parasites, if you bring them in directly into the feedlot, or if they come from a backgrounding or a preconditioning station or farm, they might have accumulated parasites. Now we're talking here about external parasites, parasites like mites, biting lices, sucking lices, flies, ticks. So there's a lot of different products that you can use. Now a combination which works really well is your pyrethroid amitraz combination, because that causes the ticks to come down or fall off the animal quite quickly, so you don't contaminate or your preconditioning stage or in the feedlot. And then the pyrethroid also helps with the slight residual effect, but also a little bit against the flies. So that's your external parasites. But it is not maintained to these two products or to these two actives, so you can use a variety. I just personally like these two actives together. There's a few products that you can use. Then we're talking about internal parasites. Internal parasites, there's two very important ones, is the roundworms. All the roundworms, some of them actually have a direct effect on the immunity of the animals, which means it's a protection that they're going to get, so we want to get rid of them. It's a well-known fact that internal parasites decrease your production, so that's why we want to clean them. And another one which gives us quite a lot of problems is liver fluke. Now we have two, not sorts, but two critical aspects of that. That's one is the adult liver fluke and the immature liver fluke. So when the cattle come in into the feedlot, you must make sure that they clean of liver fluke. Why is that important? Yes, once we kill the liver fluke in the liver, then there's some damage already. So depending on how much the damage is, we have an effect in the production. But if there's not a lot of damage, that's why we use something like a product against liver fluke, so that we have adequate and good production in the feedlot stage. So make sure that you address both the immature and the mature phase. Something like flucazole is a very nice product to use there. Something else that we need to think about is measles. Measles doesn't, you need to have a program in place, because measles can affect your price that you're getting at the end of your production phase. Then parafilaria. Parafilaria is a parasite that comes underneath the skin, and as he crawls underneath the skin, causes a lot of damage. Then when your cattle get slaughtered, you will see on the carcass, it looks like bruising, but it's also called false bruising, and it's cut off and you lose a lot of money. But all of these can be nicely managed with products. And ivermectin of sorts, long-acting, shorter-acting, you can use that. The next one is, once again, is the microminerals. We're bringing these animals into feedlot now, so their challenge is huge. If we look at, for example, an animal which is exposed to bovine respiratory disease complex, like an IBR, then the IBR infection per se can reduce the copper levels that are in these animals by half. So which means if they come in at adequate levels and they get exposed to our IBR, those levels come down to half. That means he's not adequate anymore. So that's why it's very important to get those micromineral levels up to standard before they enter into the feedlot phase. Then a growth stimulants of sort, once again, you want to use in the beginning of their phase as they go into the feedlot.